Welcome to the webinar, What Healthcare Industry Disruption Means for Your Talent Strategy, which will be presented by Nick Hines and Diane Reinhold of the Center for Creative Leadership. My name is Tracy Dobbins, and I'll be your event host today. If you're just getting to know us, CCL is a top-ranked provider of executive education globally. We work with two-thirds of the world's top 500 organizations, providing innovative solutions for the entire organization and proven programs to transform the individual. For 50 years, we've worked closely with recognized healthcare providers to achieve transformational change organization-wide. This includes development initiatives and organizational interventions for large health systems, nonprofit regional systems, and community-based hospitals, as well as public health and corporate health-related organizations. Our work is based on significant research from our own elite teams to the finest global sources, and we'll share it readily with you today in this discussion. Before our presenters begin, please know that we love participation and invite you to use the chat tool provided on the right side of your screen to ask questions or interact with the presenters. Simply direct your chat to host, presenter, and panelists, or when asked for audience participation, to send all participants. A more formal question and answer session will be held at the end of the webinar. And tomorrow, look for an email with a link to the recorded version of today's session, as well as links to various related webinar resources. I'm pleased to have with us today Nick Hines. Nick is the healthcare leader of the Americas Division, the Center for Creative Leadership. He's joined by Diane Reinhold, Senior Designer, Center for Creative Leadership. Welcome, Nick and Diane. I'll now turn the session over to Diane.
Thank you, Tracy. Let's start out by hearing from you. We have four statements up on the screen, and we'd like to know how much you agree or disagree with these statements. You can use the poll questions on the right, and please indicate how much you agree or disagree. The first statement is the healthcare industry is currently experiencing continuous and challenging disruptions. Do you agree or disagree? Our organization has a business strategy to deal with these disruptions. Our organization has identified the new skills and leadership competencies required to make that business strategy successful. And finally, our organization has plans on how to get the right people in the right place as our industry continues to change. Be sure to scroll down on the side and make sure you answer all four questions. We'll have just a few more seconds, and then we'll share the results.
Okay, looks like the results are up now.
Okay, wonderful. Well, it's very clear that most people agree that the healthcare industry is currently experiencing continuous and challenging disruption. And can we go down a little bit? Yes, the second. Here, a little more around the neither agree nor disagree and agree with our business as a strategy. Then when we're talking about the skills and leadership competency, seeing a lot more disagreement with that. And finally, at the end, our organization has the right people in the right places, quite a bit of disagreement with that. This is really the pattern that we see most often. We're experiencing a lot of disruption in today's world. Disruption cannot be avoided in today's world, but it becomes more manageable when it can be understood. We have framed the forces of disruption into a single model, which we call the RUPT model. RUPT is an acronym that captures the nature and impact of the turbulence and upheavals we experience in the 21st century. This acronym describes leading in complexity and connects the experience of disruption with the leadership necessary to navigate it. We suggest RUPT as an alternative to VUCA. It's a word in its own right, but not typically used alone. As an acronym, it stands for rapid, unpredictable, paradoxical, and tangled. Rapid. The changes we experience come at us quickly. They overlap with each other like waves emerging from different sources crashing in the ocean. Unpredictable. We can analyze, strategize, and predict the future, but then something totally unexpected emerges rapidly, challenging our assumptions and causing us to reframe our thinking. Paradoxical. As leaders, we're so easily lured into believing complex challenges have a right solution, rather than seeing them as polarities that must be balanced to be effective. For example, we must innovate for the long term and manage our current business. We can't really choose one or the other. We need to find the right balance of both. Entangled. Everything is connected to everything else. We live in multiple ecosystems, all of them having internal and external connections that we need to consider in our attempts to strategize and implement strategy effectively. Disruption comes in many forms and from many places. We've identified 4 meta forces that are most often the source of disruption: technology, consumer, or in this case, patient-related disruptions, industry, and global and societal. Nick, would you describe how these disruptions look in the healthcare industry?
Absolutely. Thank you, Diane. In healthcare, today's patients expect to take a more active role in their medical care. Healthcare service delivery organizations must improve the patient experience by sharing information and empowering the patient. This increases their overall health literacy and self-management. In addition, they need to find new ways to deliver value by investing in digital services and building an ecosystem with other healthcare providers to coordinate treatment and improve outcomes. Before we move further on this topic, we would love to get your thoughts on a question that's posted in the chat function. And if you have some examples of what this looks like in your world, please let us know what's going on so that we can learn from each other. And that question is right around, is your organization experiencing consumer disruptions? What do they look like in your world? And as you respond to that, we'll continue on with the presentation. Here are a few of the implications that these disruptions will have for healthcare and their talent. As more power shifts to the patient, how does the organization's talent reconcile a perceived or real shift in power from them to the patient? How can your organization reconsider your patients as a source of talent? How can they be leveraged for collaborative problem solving? How do you develop patient-centric skills such as empathy and listening so that a patient-driven culture can take root? With many gaps between what the patient expects and the organization is currently delivering, how does the organization prioritize and avoid spreading itself too thin? Today, when you create a superior digital consumer experience in healthcare, you drive everything from brand awareness to patient acquisition to consumer engagement and lastly to patient loyalty. Consumer experience has become a growing priority in the last decade for a number of reasons, namely policy, leadership choice, and implications for reimbursements. The business implications of these disruptions are patients and their families become more empowered. They're empowered through the sharing of information. The entire continuum of care and each touch point throughout the care model improves the overall experience. Diane, tell us more about how the consumer experience actually impacts the business regarding talent.
Yes, it all starts with changing your talent mindset. What are the practices, policies, and values that guide our approach to talent? And do they lead to a patient-centered culture? How well does our current talent mindset suit the new world of healthcare, or is it a little outdated? We also have to look at the talent processes. Most of them were actually created with employees in mind, But now we have to think about how do we engage doctors and nurses who work with us but aren't on staff? And how do we develop our talent to create a patient-centric culture? And finally, we have to look at our people. How can we anticipate changing patient expectations? How can an organization actually use its patients as a source of talent? And look at consumers. Okay, so we've really looked at consumer-related disruptions pretty thoroughly. Let's look at the other disruptions.
Today's healthcare organizations must compete in the digital realm with tech-savvy disruptors. Healthcare organizations must explore how artificial intelligence and machine learning can be used in clinical trials to provide precision medicine. It must focus on cybersecurity best practices, including training your people to identify threats and collaborating with medical device vendors to improve patient privacy. Is your organization experiencing technology disruption? How are those new technologies changing the way you serve patients? Once again, if you don't mind sharing your thoughts in the chat function, we'll monitor those and refer back to them later on in the presentation. Here are a few of the implications that leveraging digital technologies will have for healthcare organizations' talent. Healthcare entities will have to decide if they are ready for talent other than human talent, if they are ready for talent-related risk and false starts associated with implementing new technologies. How open is the organization to leveraging external talent to deal with sudden technology disruptions? Those same organizations must be able to innovate quickly, implement new business models, and create ecosystems to provide total care for patients. The largest and most important payer in the country, our federal government, is providing and driving those healthcare providers to value-based care models where reimbursements are based on patient outcomes and not fees for service. Some healthcare providers are working at the leading edge of this model of care and re-engineering themselves for the future, and you can read about how one of those organizations made this transformation in our upcoming white paper, The 3 Keys to U.S. Health System Success in the 2020s. Industry innovations such as bundle payments, specialty drug pricing, the integration of insurers and providers, and the entrance of healthcare middlemen into the supply chain are dramatically changing the way healthcare organizations run their businesses. More is being accomplished in cross-functional teams, sometimes including team members from multiple organizations. Healthcare organizations are being asked to explain their pricing models and educate payers and end users about options. The ever-changing healthcare landscape presents many growth opportunities for dynamic organizations. How is your organization responding? Again, share your thoughts in the chat function on what is your organization doing around these large-scale industry disruptions. Here are a few of the implications that these industry changes will have for healthcare organizations and their talent. The organizations have to balance their experimentation with new innovations while minimizing risk. As mergers and acquisitions and partnerships activities increase, how can talent integrate different mindsets and practices? How do those organizations keep pace with industry upheavals and acquire unconventional talent? How can new mindsets and practices be brought into the organization's culture? And lastly, societal disruptions. Our societies are expecting more from healthcare providers. Today, healthcare organizations must find ways to improve access to healthcare for underserved populations. In addition, they need to anticipate changes in regulations so that they can actively address new requirements. How well is your organization responding to these changes? What steps are they taking to tackle these societal disruptions? Here are a few of the implications that changing societal expectations will have for healthcare and their talent. Increasing access to healthcare will require organizations to look at new ways to reduce expenses and explore new delivery options to expand their reach. How can healthcare organizations develop a proactive rather reactive approach to compliance? No one organization can address large, complex societal disruptions alone. How can healthcare organizations work together to address these needs?
Let's hear from the group. How are you experiencing disruption? Which of these 4 meta-categories, technology disruptions, consumer disruptions, industry disruptions, and societal disruptions, do you feel your organization is best able to deal with? And which of these 4 is most challenging? We'd love to hear your thoughts. So once again, we have the 2 questions posted as a poll on the right. Please select which one you think your organization is best able to deal with and which is going to be most challenging. And let's just give that a little bit of time, and shortly we'll share the results with you. So if you haven't yet, please make your selections. All right, tallying up the numbers right now. We'll be able to share the results in just a second. Thank you. So it looks like over half of you feel that industry-related disruptions are the ones that you're best able to deal with. And there were a lot of examples in the chat around expanding access for rural patients, and as Nick talked about, with the federal government moving to value-based payments, these are huge industry-related disruptions. And when we look at the ones that are most challenging to deal with, you seem to be a little more all over the board on that one. So all of them can be challenging. I really did like reading some of the examples. I know with consumer, people talked about patient empowerment and even having patients share their experience in clinical trials. With technology, we had a lot of comments about improving access through telemedicine, having greater access to the teams by email and text, self-scheduling. All of this makes it much easier. And societal, a lot of people talked about changing demographics, and all of these are going to be very challenging. And so let's hear a little bit about what you can do about those challenges and how leaders can prepare for disruption.
These disruptions require attention and focus on the preparation of your leaders. To deal with those disruptions and prepare for the new world of healthcare, leaders and leadership teams must adopt new behaviors and work together in new ways. The following 3 pillars are identified in the release of our upcoming white paper. Fostering interprofessional collaborative practice as their clinical cultural operating system. Collaboration and learning from others must become second nature for physicians, nurses, and other clinicians. Embracing equity, diversity, and inclusion. Cultural competence skills are must-haves to provide compassionate care, improve access and outcomes, and achieve equity. Encouraging boundary-spanning behavior beyond the institution. Working across and beyond traditional boundaries is critical as health systems seek to build high-impact healthcare collaborations alongside public health organizations, independent clinicians, and others in the community. Let's take a few minutes to explore these further. Fostering interprofessional collaboration. Leading voices in healthcare, professional education, and practice have recognized that interprofessional collaborative practice is the key to safe, high-quality, patient-centered care. This is the kind of care that clinical teams must provide in value-based models. Interprofessional collaborative practice goes beyond simply coordinating work. It asks healthcare professionals to learn from one another and appreciate the value that each individual brings to a healthcare system, the community, and individual patients. This means, for example, that physicians must be able to hear, appreciate, and acknowledge the contributions of nurses, pharmacists, and other professionals. It also means that all providers, a diverse range of clinicians, public health officials, and stewards of socially responsible care, must be considered a part of the community health infrastructure. This new integrated healthcare delivery model requires leadership and cultural changes. Health systems must reconsider org charts, committee membership, and other structures so that all relevant clinical and non-clinical professionals have input and shared decision-making authority. Rethink recruiting, talent management, and leadership pipelines to encourage and reflect contributions from a more diverse array of professionals. Change culture so day-to-day patient care decisions are informed by the full team of clinical professionals that are all charged with delivering optimal health outcomes. As we embrace equity, diversity, and inclusion, communities, patient populations, and staff are more diverse and varied than ever before. Racial, ethnic, linguistic, national, origin, sexual orientation, gender identity, religion, and many other differences are increasingly acknowledged, respected, and appreciated. But healthcare outcomes have not kept up with the increasing awareness of this diversity. Patients who identify with minority and historically marginalized communities frequently have worse health outcomes. Providers must provide compassionate care and also produce equitable health outcomes. This is pushing health systems to grapple with the barriers that prevent people from accessing care. Leaders in healthcare must be committed to evaluate and critique their own actions. They need to address power imbalances in encounters with staff, as well as clinically in the patient-provider relationship. This will help develop and maintain mutually respectful partnerships. Culturally competent care is a critical part of the prescription for success. In healthcare, cultural competence is the ability of providers to understand and integrate cultural differences into the delivery of care. The goal is to provide the highest quality of care to every patient, regardless of race, ethnicity, cultural background, English proficiency, or literacy. Clinical staff must understand the home life that the patients return to. Who will their primary caregivers be at home? Do they have access to transportation or a local pharmacy? How easy or difficult will it be for them to set and get to follow-up appointments, access rehabilitation or therapy services, and continue their recovery outside the hospital walls? Do they have financial resources required for all of this? To develop optimal health outcomes, healthcare providers must also work to ensure their staff, clinical and non-clinical, reflects the diversity of the communities they serve. A healthcare workforce that is part of the community is more likely to deliver superior health outcomes. And as we're embracing the expansion of boundaries, in our healthcare leadership white paper from 2011, we identified boundary spanning as one of the most critical leadership capabilities for healthcare providers. We recognize that silos that historically had existed in health systems between inpatient and outpatient teams, for example, or between clinical and non-clinical units needed to be bridged. In our upcoming white paper entitled 3 Keys to U.S. Health System Success, we describe how one organization, the North Star Network, responded to today's even greater pressure to build community partnerships and collaborate with healthcare and non-healthcare players. They convene leaders from over 100 healthcare organizations and provide leadership development opportunities for over 60 leaders per year while addressing the most pressing topics in the healthcare landscape, including cost and quality of care. To deliver high-quality health outcomes, North Star found themselves working with an endless array of potential collaborators and allies, churches, advocacy organizations, local governments, and even competitors. The initiative over the last 10 years has resulted in Rochester having the lowest Medicare cost and fourth lowest private insurance cost in the nation per capita.
So, is your organization prepared for disruption? How well do you embrace disruption? Organizations that embrace disruption can change on the inside at the same rate of change that they are experiencing on the outside. They have the potential to emerge as the disruptor rather than the disrupted. Organizations must be able to respond to changing conditions quickly. Data from McKinsey and Kelly underscore that healthcare organizations with agile talent portfolios, which is the ability to leverage all types of internal and external talent, respond quicker to changing conditions and have greater ROI. This means building ecosystems with all the groups involved in your local healthcare community. Organizations need to allocate resources quickly. The ability to respond quickly requires getting the right people in the right seats at the right time. And organizations with strong talent networks can do that and allocate resources without going through the traditional hiring process. Healthcare organizations are going to fight to attract and retain premium talent in the future. As a result, healthcare organizations will need to build an employer brand and an employee value proposition that demonstrates that we know talent and we know how to manage it, especially as the talent war continues to heat up. Developing an agile talent portfolio requires a mindset shift from the traditional approach to one suited for the new world of healthcare. Talent planning cycles must come more frequently, with talent gaps and reskilling needs being identified on an ongoing basis, not an annual one. Long hiring cycles can cause detrimental delays, so healthcare organizations need to focus on access to talent, not acquisition, and develop an ecosystem of their talents. Fully leveraging that ecosystem requires identifying the tasks to be done, which can be addressed quicker than filling roles. As a result, in today's world, managers must be able to lead teams of employees, contractors, freelancers, and understand when to apply AI and bots. Organizations must develop long-term relationships with their short-term talent, such as physicians and nurses who play a critical role in caring for your patients, but aren't really part of your organization. Organizations must break through silos and create teams with different types of specialists, nurses, administrators, and even people from outside the organization. The focus is creating a patient-centered culture, not an organizational structure. The Center has created a variety of tools and approaches to get better at identifying and adapting to the organization's changing talent needs. Here's a quick overview of our integrated suite of tools and services. We offer some industry insights like the RUP report, which I'll be talking about in more detail soon. We have a suite of assessments that look at the agility of leaders and teams and organizations. Many of these are offered by our partner, Agility Consulting. We offer leadership development, including a one-day workshop on leadership agility for the new world of healthcare. We also offer team development, like a recently launched workshop kit, Embracing Disruption Through Talent. And we have a variety of organizational development initiatives that look at what you're doing well with respect to talent, where gaps might be from where you need to be, and specific suggestions on how to improve. But today, I'd like to focus on the RUP report. Right after this webinar, you will get a conversation guide on disruptive trends impacting the healthcare industry. This is an executive summary of our RUP report. If you're interested, you will also get a link that will allow you to download the entire RUP report. It's about 40 pages and goes into great detail on the 4 meta-categories of disruption, samples of what those disruptions look like in the healthcare industry, their implications for business, and the implications for talent. So let's hear from the group. What questions do you have for us now?
Again, just send your questions in. You can direct them to all participants and put your question in the chat feature, and we will address them in the order that they're received. We've got a few questions to start with here that have come in. Can you say more about what a talent ecosystem looks like?
Sure. A talent ecosystem consists of employees, full-time, part-time, virtual employees. It has contractors like nurses and doctors who partner with you on an ongoing basis. I might have contractors that come in for short term, or you might work with some community organizations or other healthcare organizations. And all these people, all these groups would be part of your talent ecosystem.
Thank you. Another question about what advice would you give to a leader on how to manage teams consisting of employees and contractors?
Oh, that's a good one. I think that the thing to really keep in mind is that people are people regardless of the employment contract. And we all have needs to belong, and we all need to have our unique contributions recognized. With all of your talent, be sure to ask them for their input. They may have a wealth of experience that you're not aware of. And when you can, include them in just lunch and discussions, and just make them feel like part of the team, even if they're not on staff.
Anne Marie asks what specific new skills are becoming necessary for employees and managers?
I'll take this one. Great question. As we think about leadership, and obviously we're a leadership development organization, we always concentrate on the power of influence and communications and strategy. What we're finding with a number of our clients, as well as the industry, especially in healthcare, is that a skill or behavior, more or less, that is required for organizations to be successful moving forward really is to develop a culture of appreciation. It's an appreciation for differences. It's an appreciation for the diversity and the demographics of the patient population that you're caring for. It's an appreciation for the regulatory and other environmental and landscape shifts that are occurring within healthcare. These are the things that we like to call developing a culture of appreciation as a skill and a behavior within leadership development, prepares leaders as well as key decision makers and administrative levels to make really good decisions about the patient and their families, those citizens within the community that they're caring for. So I think one of those probably more popular and newer skills and behaviors that we're seeing a lot of is for organizations to have the know-how to develop a culture of appreciation. Diane, would you have anything to add?
Sure, and I'd like to add agility. So in today's world, with all the disruption that we're experiencing, agility is becoming more and more important. And in the past, we used to talk about dealing with change, like standing in a river, and you're standing in the river and the water slowly flowing by, and all of a sudden you'll get this rush of water, and you have to hold on to something and wait till that rush is by. But now the water just keeps rushing and rushing, and you have to learn to let go and just go with the flow. So agility and going with the flow are important skills.
Thanks, Diane and Nick. Rick is asking, are there any overarching leader qualities or behaviors that are more effective in leading through the 4 disruptions?
Yeah, there's 5 that we talk about. So we talk about anticipate change, generating confidence, initiating action, leveraging new thinking, and evaluating results. And those 5 are the 5 components of the Agile model. Nick, anything you wanted to add?
No, I think those core qualities are really important, Diane, and thanks for the question, Rick. And as you're thinking about the different disruptions that we've discussed in this particular webinar, I think that we can all see that there are some technical, there's some human, emotional, and social disruptions that are going on within those categories. So the leadership qualities associated and affiliated with shifting and creating change within those disruptions are going to vary. But I think the core list that Diane just gave are a really good starting point, and it's something that can be built upon readily by any organization.
Diane, could you repeat those 5 again?
Oh, absolutely. So anticipate change, generate confidence, initiate action, leverage new thinking, and evaluate results.
Thank you. And I'll send those out in the chat to you. Another question that we have from Michelle, how might cultural humility improve the patient experience?
Thank you, Michelle. This question really gets at the heart of a large component of the talk today around equity, diversity, and inclusion. Hopefully the audience heard that we were really concentrating on creating a culturally competent care model. And cultural competence aligned with cultural intelligence, we believe, does create the cultural humility that is required to really understand and appreciate those differences as we spoke about, but also to provide the best and highest quality care to those patients and their families in their time of need. So as we move forward and think about 2020 and beyond, there are a couple of things that are occurring in the healthcare space that you all, I'm sure, are very familiar with, including January of 2020, where the Center for Innovation under CMS and their headquarters will start to look closely at those value-based KPIs and metrics within the communities of many healthcare systems are serving. Those communities haven't necessarily changed. The zip codes and the outcomes within some of those zip codes have changed. So how do we become more culturally aware? We have culturally competent care models. We drive wellness in the community from the 4 walls of the hospital back to community and population health organizations. It all requires that cultural humility that you're speaking about. And at the end of the day, it's not about HCAHPS or any other metrics from a patient satisfaction. It's about their overall experience and how well they become because of the care that they've received from the healthcare organization, which drives healthier communities and hopefully drives for better outcomes within the healthcare ecosystem in the future. Great question. Thank you so much, Michelle.
Question, how does your organization currently integrate leadership development into ongoing talent management systems?
Yeah, so this is a pretty provocative question because I think that organizations have their own ways and cultures of managing talent. One of the things that we've done within healthcare organizations is to talk about their talent management systems and their people management management and performance management, but then how does that talent become deployed to execute on critical strategies? The execution on those critical strategies and the implementation of work plans and operational process improvements, quality care improvements for the healthcare space, all of those require a level of leadership development to manage the overall change. Those shifts in the mindset required to deliver higher quality care, the mindset shift that is required to deliver care in a more culturally competent way, the mindset shift that's required to deliver care in a much more efficient and a streamlined and defect-proof process, such as dyad leadership and continuum of care leadership in the collaborative models. All of those require leadership development as core guiding principles to influence the talent management and the outcomes of those systems that you have in place. So within the healthcare space, we've been practicing the integration of those core principles into your performance management processes, and what we've driven are better outcomes and execution within healthcare organizations that we partner with.
And I'd like to build on to what Nick is saying, because what we're seeing a lot of is leadership development built actually into the work. So we're doing more and more action learning, action development, and more around real work, real strategic initiatives. So it's moving out of the classroom and into the workflow.
Thank you, Nick, Diane. And the question is, how quickly has your organization responded to industry, societal, technology disruptions, and how was leadership development included in that process?
Yeah, I'll start, Diane, and
okay,
you can
sure.
Add to it if you would like. So this is a really good question because this is the topic that we've discussed with the audience today. Yet, very much like many organizations, we're all in a cultural transformation because of industry shifts, whether it's particularly in healthcare or the many other industries that the Center for Creative Leadership services across the world. And so the way that we've thought about it is we do have a centralized focus on digital transformation. We do have a centralized focus on the healthcare disruptions, as you've heard today in this particular webinar, but also the societal disruptions. The Center for Creative Leadership and its mission is about impacting society through leadership development. The way we do that is continuously hone in on and refine our skills, our behaviors, as well as our program services and offerings to the world. It doesn't matter what region of the globe you live in, CCL has impacted it. So like many of our clients and the organizations that we partner with, we took the bull by the horns, for lack of a better term, and assured that we had infrastructure, operational improvements, and leaned out processes so that we could address those industry, being healthcare industry today, societal and technology disruptions. Diane, anything else to add?
Sure. I'd like to say one of the things we believe at the Center for Creative Leadership is that we will test out and use the same services and products and programs that we share with our clients. And so we have been undergoing a rather large internal process looking at what are the disruptions that are affecting our markets and how do we need to set up to handle them better. So it's actually a process we're going through ourselves right now, and it is fascinating. The implications reach into everything, even if you talk about something like technology, and AI is something that is affecting our industry very much, and its implications are huge. It's not just being able to use the technology, it's understanding how it impacts the business, how it impacts the clients that we serve, and how it can open up opportunities for new services and new products that we didn't think about, and also how it could create new efficiencies. So it's really been very disruptive. You know, a complete transformation. So we're going through this journey as well.
Okay, well, thank you. It looks like we have addressed all the questions. Unless there's any others that people would like to send in, we invite you to just send those in to all participants. But for now, it looks like we've addressed the ones that we've had, and we want to thank Nick and Diane for sharing ways to manage your healthcare talent with greater agility through innovative approaches. Tomorrow, everyone who attended will receive a follow-up email with a link to the webinar recording and information about the conversation guide, and which leads to the white paper. We hope our attendees enjoyed the session and will join us again for a future webinar. As you exit the webinar today, we hope you take a moment to complete the evaluation so we can continue to make these events well worth your time. You can also request that a CCL team member follow up with you. Again, thank you, Nick and Diane, and to our audience.
Thank you, Tracy.
Thank you.
Bye now.